Since the start of the pandemic, experts have been trying to nail down patterns of COVID-19, and we now know the Houston area basically experiences two waves every year. The winter wave peaks between January and February. The summer wave is actually happening right now. Dr. David Pearce, Chief Medical Officer for the city of Houston, is joining me now to talk about the current situation and how you would describe the recent trends in the wastewater. Good morning, Dr. Pearce.
Good morning, Haley. Thanks for having me back. And yeah, we're seeing that in the wastewater, which is a good reflection of what's going on in the community. The amount of virus has gone up. It's as of last Monday, we get the reports on Mondays. I don't have today's yet, but last week it was at 333% of the July 2020 benchmark, and that was the peak of the first wave. Now, to put that in context, we've been much higher. We've been as high as 1,500%, but at 333%, it's definitely high. But what is also important to know is that it is increasing, and it has been increasing for several weeks, a couple months actually. And so, yeah, we're in that summer wave. And, the other thing about COVID is I often say that, this virus is breaking all the rules. It is not behaving like any of the other viruses we usually deal with. And one way is that we have a winter wave, which is not a surprise. That's kind of viral season. But we continue to have this summer wave, which is unlike, the flu virus and the rhinoviruses, the cold viruses. We pretty much only see those in the winter months. We continue here years later. We continue to see this summer wave, and that's unlike most viruses that we deal with. Now, the other good news is that we're seeing almost no deaths, very, very few deaths, which that's great. It's not zero, but it's really small. But we are seeing a lot of people still getting hospitalized. Again, less than what it used to be, but nevertheless, people are still getting hospitalized, and so that that's worrisome.
Yeah. Well, I guess, are you worried with kids going back to school? That's the typical time of year when germs really start to spread. So who should be concerned about this COVID spike now as kids are returning to class?
Yeah, so again, this is not a new concept, but I want to remind folks that the people that are at greatest risk from having a bad outcome with COVID, whether a bad outcome, again, we're not seeing many deaths, but we do have long COVID is a real thing. We do have people that get sick and become sick for weeks. They're out of school or they're out of work for a while. So there are some serious consequences to the COVID infection. But those at greatest risk are, again, it's the very young because their immune system hasn't developed very much yet, and the very old because it's not as robust as it used to be. And again, with the very old, they often have other illnesses, diabetes, heart disease, hypertension, that when they become sick with COVID, they're going to have a much more difficult, time with it and getting better. So this is why we want to remind folks that, anyone over the age of 6 months can get vaccinated for COVID. But let's say you're a young, healthy person and you think, well, even if I get sick, I'll be okay. If there's a young person, a baby, an infant, or an elder person in your family, or somebody who has a chronic illness, whether it be diabetes, heart disease, HIV, what have you, if they're in your family, remember that the people that you are most likely to become infected from is another member of your own family. So while you may be young and healthy and think, I don't need it, remember, you're a line of defense for that other person in your family who is at risk. So we all need to seriously consider, staying on top of the COVID vaccines, which, by the way, we recommend about twice a year. And here's another thing. The version of the vaccine that's going to come out this fall is an updated version. So if you had last year's, and it's more than 6 months, not only are you due from a time standpoint, but you're also going to be due because it's now going to be an updated version coming out this fall.
That's what I was going to ask you, is if we're still updating the vaccine and if people need to continue getting it as the updated versions come out.
Yeah, and another thing with this virus now, this is one thing that's not terribly unique about COVID. One of the reasons that we get a different flu shot every year is because the flu virus changes. The flu virus, in the winter months, it's in the northern hemisphere, and in the southern months, it's in the southern hemisphere. And for us, it's constantly changing. So that's why every year you should get a new flu shot. Well, COVID does the same thing. It's constantly changing. It's evolving a little bit every year. And so this is why there's going to be a new version of the vaccine coming out this fall. So yeah, even if you got a shot last year, or if you got a shot, earlier this summer, you probably need to get the updated one. I'm going to get the updated one, I'll tell you that much.
And we know that the vaccine still remains the best way to prevent the virus. But will you take this opportunity also and remind people, how you were mentioning all those people with chronic conditions who can still get seriously ill? What are the treatments available if they do become sick with it? Because there's still things that you can do as soon as you feel the symptoms, right?
Yeah, absolutely. That's another advance that we've had over the last several years, that there are now antivirals that can be administered to patients who are actively infected with it. Some of them are oral, like Paxlovid is the big one that everybody talks about. And again, you want to get this started right away within the first couple of days. There are others for people who have more complicated situations or maybe getting sicker at a faster rate. You talk to your doctor. There are some IV forms as well. Some of those can be given on an outpatient basis, and if you're too sick, you can get those. If you wind up being hospitalized, you can, there are things that they can do for people who are hospitalized. But the pill form, which is probably the most widely used, is really effective. But you gotta, as soon as you get the symptoms, you want to say. Now, here's the other thing. After several years, most of us have either got several vaccines on board, or we've been sick a couple times, and so we have some immunity. So we're not getting as sick. So when you get some sort of flu-like symptom, particularly here in the summer, you got to really think, is this COVID? Test yourself, because then you want to get on the medication as quick as you can. And what I'm hearing is that some people think, well, I didn't think it was that bad. And by day 5, they finally tested themselves. Well, now it's never too late, but you're really kind of outside the window for the best impact of the medication. And here's the other thing, keep in mind. If you've been vaccinated or you've got high immunity, you may be exposed to the virus from somebody, but you may not get sick at all. So that's great. And if you get sick, you may not get nearly as sick. So, again, reasons to make sure you get vaccinated. But should you develop the symptoms, you want to get on that pack. So again, while you may be young and healthy, and you may not think you're going to do too bad, you are still a line of defense for somebody else, whether it be a member of your own family, somebody who you work with, perhaps somebody in your neighborhood. You are a line of defense. We want to stop the virus should you become infected. So, again, I just want to make sure people have that perspective as well.
Good message as always, Dr. David Pearce. We appreciate your time this morning. We will clip this and put it on our website, clicktohouston.com, so people will have this information, especially as they head back to school and start exchanging those germs between households.
Yeah. Thank you, Haley.